Hello viewers, my name is Dr. Jessica Muthe of Elim Guidance and Psychological Services Center. Today I'll be talking about signs you could look out for in depressed people. How can you spot people with depression around you? That is what I'm interested in. Now, in the year 2020, when the COVID-19 surge was at its peak, Kenya was ranked the 6th with the highest number of depression cases in African countries. That is according to the World Health Report of 2020. That is the World Health Organization report of 2020. The same report also indicated that 2 million depression cases were reported in June in Kenya. It was also reported that 1 out of 4 people who sought health care in Kenya had mental health conditions. I would like to indicate that depression can lead to disability if it is not treated in time. Having talked about the alarming state of this mental health condition, it is important to alert you on how to recognize signs of depression around you. What are some of the signs that we could look out for people with depression? Or rather, how can you recognize or spot an individual with depression around you? I would like to discuss a few of these signs or these pointers. One of them is appetite and weight changes. Now, eating too much or too little can suggest the presence of depression. Some people turn to food for comfort, while others lose their appetite or eat less due to low moods that are caused by depression. And these changes in food intake can actually cause a person to start gaining or losing weight. The second pointer that I would like to address is change in sleep habits. There is a strong link between mood and sleep. Lack of sleep can contribute to depression, and depression makes it very difficult for one to sleep. Numerous research studies also have suggested that chronic sleep deprivation actually can lead to depression. And this may be due to neurochemical changes in the brain. The third pointer could be alcohol or drug use or abuse. Some people with mood disorders may also use alcohol or drug to cope with their feelings of sadness, loneliness, and hopelessness. Research indicates that in 1 out of 5 people with anxiety or mood disorders, such as depression, also have alcohol and substance use disorder. The other pointer is fatigue. Although everyone feels tired from time to time, people with severe or persistent tiredness could actually be having depression. And fatigue just means a feeling of excessively getting tired, and it is also a very common sign of depression. Research suggests that over 90% of people with depression experience fatigue. The other pointer that I would like to look at is forced happiness. A person with depression can actually force happiness. Sometimes people refer to it as hidden depression, as a smiling depression. And this is because people who hide their symptoms try to put on a happy face when in the company of other people. It may be a bit difficult at times to keep this forced happiness, and so the mask may slip off and a person may show signs of sadness, hopelessness, or loneliness. The other pointer is a person being less optimistic than others. People with depression have been known to be very pessimistic. That means they are very negative about even future. Studies also have revealed that those with major depression disorders often are more negative or have more negative view of future. The other one is loss of concentration. This means that the person affected trails off during conversations, and they may lose their trail of thoughts. They have issues with memory and concentration. And this is supported by studies that indicate that difficulties with concentration and focus can worsen the social impact of depression by making life and personal relationships a bit challenging for those people. The eighth one is disinterest in hobbies. The person loses interest or pleasure in hobbies and activities they once enjoyed. Maybe they loved golf, they loved going to church, they loved soccer, basketball, and all of a sudden, they just absent themselves from those kind of activities. I mean, there is need to be concerned and find out whether the person has depression. The ninth one is physical pain and health disorders. Depression is a mental health condition, but it can also have a physical consequences in addition to the weight changes and fatigue that we talked about earlier. Other physical signs to look out for in a person with depression may actually include things like backache, chronic pain conditions, sometimes digestive problems, headache, and so on and so forth. This has been supported actually by research. Research studies also show that those with major depression are more likely to experience conditions like arthritis, autoimmune conditions, cancer, heart diseases, type 2 diabetes, etc., etc. Number 10, being angry or irritable. Many people do not associate anger and irritability with depression, but those mood changes are not usual among those with this condition called depression. Instead of appearing sad, some people with hidden depression may display things like irritability and overt or suppressed anger. The 11th one is low sex drive, what we would call low libido. And research has found out that low sex drive is a key indicator of major depression. Fatigue and low energy levels have also been reported, and low self-esteem is associated with that also. Now, viewers, in case you are experiencing such signs, or there is somebody around you experiencing the same, look out for a counselor or a therapist near you, or a medic, and that is a psychiatrist, doctor, or a physician, and get help. Otherwise, it is important to note that depression kills, and it also leads to suicide, and it can also make one disabled, or it can bring disability in a person once it is untreated. Depression also, we have said, your mental health in the past. We have always said your mental health is your wealth. Take care of it. Thank you very much.